We want to get started for the people who are on now. First of all, my name is Conrad Gilbert. I'm the Director of Community Engagement at Friend Health. And for some of those who know and those who don't know, we do a monthly lunch and learn to provide information and education to our patients and people who even are not our patients about different health topics. Our objective is to provide you with information so that you can be proactive about your health. Means that you should go and see about yourself, basically. Get different things completed in terms of your age group, things you should be looking out for. You'll learn a lot of that today with Dr. Kidder. But again, we try and take a proactive approach about giving you all information so you can do a better job of just taking care of yourself, okay? Let me start off with just give you some information about Friend Health Clinic for those who may not be aware. Tony, you want to go to the next screen? Okay, again, Conrad Gilbert, myself, and then we have Sarah Kidder in Guyenne. She's been with us for over 4 or 5 years, I think now, Dr. Kidder, if I'm correct with that. Okay, and she's my go-to doctor in a lot of situations. She's been very helpful over the years. She was on WVON talking about heart health about 2 years ago. She's done many educational presentations for us here at the clinic. And she's a wonderful person and a wonderful doctor. You guys keep that in mind. If you need to have a doctor, she would be someone I would come to. I'm being honest with you. Next slide. Okay, all patients are welcome at Friend Health, regardless of their ability to pay. We accept Medicaid, Medicare, as well as commercial insurance. We also offer a sliding fee scale discount program to uninsured people, which is based on your household size and your income. Now, let me just say this. We are a FQHC. What that means, a federally qualified health center, means we have to see everyone who comes to our door, regardless of their insurance information, regardless to their job situation, and regardless of whether or not they have a home or not. We are here to serve and sponsored by the federal government. Next slide. Okay, here are some of the services that we provide. I'm not going to read them all, just kind of hit on some hot ones. Currently, behavioral health is really, really key with all the things that we've all been going through over the last 2 years, 2.5 years with the COVID. And all the other things that are taking place in our lives. Behavioral health is becoming more, people are responding to it a lot more. Behavioral health does not mean that you're mentally unstable. It means that you have some concerns. It means that you have some things you need to talk about. If it rises to the level where you have something that you have to really take care of, we have the facilities to handle that as well. Okay, so do not be afraid to use behavioral health just for general conversation. You know, you need to get some stuff off your chest. You need to talk about what's going on in your house, in your family, or something like that, or someone in your family who needs help. We can help you. Other areas like, say, pediatric medicine, dental services, health insurance enrollment. Those are some of the areas that we have available. Next slide. Our dental locations, we actually have 2 of them. These are the items that we actually handle. Exams, x-rays, cleanings, you can see that, fillings, education. The key thing there is we have 2 locations, 5635 Pulaski, and the other dental office is at 5843 South Western. So those are our 2 dental office locations. As you see, we accept Medicaid, commercial, just like before. We accept all insurances, or even if you don't have insurance, we can work with you. Next slide. Here are our locations, 4802 Ashland, 800 East 55th Street, 5635 South Pulaski, 5843 Southwestern, and the jewel in the crown, the jewel of our crown is my location, 1522 East 63rd Street. Next slide. All right, welcome to our behavioral health integrated services. Next slide. All right, integrated services healthcare teams provide active referrals for services that may be a result of substance use or misuse, anxiety, sadness, and other behavioral concerns. Next slide. Here, their main location is here. I want to point this out to you, 200 East 115th Street. What I'm really telling you there is that if you have some concerns, call that number, 312-441-9009, and they will be able to address, it's open 24 hours a day, that number is, 24 hours a day, 7 days a week. They'll be able to guide you to where you need to go, because they have a couple different locations throughout the city. Next slide. Here are some of those locations, the Roseland community, which is our triage center, the one I just talked about. We have MAT programs at 40 East 51st Street. The other one I want to point out to you is our Southwest Central 33 East 114th Street. Adult counseling, we have supportive services there. And then we also have family case management at 8151 Southwest, right? We deal in particular, that particular location actually works with a lot of young women, pregnant women. They're trying to assist you in, kind of getting the things that you need to have. Next slide. All patients are welcome to Preventive Health. As I said earlier, the ability to accept Medicaid, your ability to pay has no bearing on getting services here. We offer the sliding fee program, as I said. In order to get involved with that program, really all you need to bring is a photo identification, proof of income, and address. If you don't have income to prove, then it's not a problem, right? Don't worry about that. Next slide. Okay. If you do want to contact someone, if you ask more questions, you can call me, Conrad Gilbert, at 312-863-0660, or you can call Mr. Corbett. His number is 312-989-5995. So whatever your questions are, don't worry about it. We're not doctors. We should be able to lead you to where you need to go. That's our main objective, to put you on the right path to good health. All right. Thank you very much for that. I'd like to just move on now to Dr. Kidder, because she's the star of the show today. And just basically want to let you know that we are available here for you. If you have any questions, you can call that name and number, the names and numbers that I gave to you. And I appreciate you coming on with us today. Thank you so much. Dr. Kidder.
Good afternoon. Can everyone just give a quick wave if you can hear me okay? Excellent. And Tony is going to assist with the presentation today. We're going to be talking about preventive healthcare or a yearly checkup. But I want to start today with just kind of a brief meditation. And I want everyone just to take a quick moment to think about their favorite teacher. Just take a moment to kind of remember that person, what they may have done for you, how they may have played a role in your life. For me, it was a science teacher named Mr. Magnuson. I really wanted to take his class, but it was for older kids. And I came to him and I told him how much I really, really wanted to take his class. And he kind of thought about it. And thank goodness I had a smarter older sister who he had already had, because he trusted her. So he said, it's going to be hard. It's a hard class and it's a lot to learn. It's going to be like swimming across the English Channel. I've never seen the English Channel, so I like to think of that as Lake Michigan now. It's going to be like swimming across Lake Michigan. And you're going to have to just keep swimming forward and keep going and keep going. And eventually you'll get to the other side. And it's going to be hard, but you can do it. And it's something that I have carried forward with me throughout my life in many different challenging situations. Why am I bringing up teachers? Number one, teachers are wonderful. Number two, I view my role as a family medicine doctor very much as a teacher at times. And number three, we wanted to give you a tool, a really helpful tool for your next checkup. So no one freak out, but we're going to talk about report cards. A report card as a tool to help you assess how you're doing on the things that you need to be doing to keep yourself healthy and well. Next slide, please. So the goals of our presentation today, it's only 10 slides. We should be able to get through it pretty quickly. We want to talk about what a checkup is, right? When you schedule a checkup or your yearly physical, what is that? What should happen at that visit and why is it so important? And then I want you at the end of the presentation to have an idea of what care you need at your next physical based on your age, your gender, and some other factors. Next slide. So getting a yearly checkup is really about preventive healthcare. And when we use the term preventive healthcare, we're talking about two things. We want to prevent disease, we want to not get sick, and we don't want to die. At least we don't want to die early. We're all going to die at some point, but we don't want to die early. So that's what getting a checkup is all about. Preventing disease, preventing premature death. So when we kind of think about, well, what's most likely to kill me, Dr. Kidder? Here in the United States, and you can click forward, Tony, the biggest killer here is heart disease. But if you want to take a quick look through that list, things like cancer, stroke, lung disease, accidents, things like buckling your seatbelt. I'm going to remind you to buckle your seatbelt and wear your helmet. These are the things that I'm thinking about and when I'm trying to help you stay healthy and stay well. Forward one. We have to add COVID because last year COVID became one of the leading causes of death in the United States, and it is definitely a preventable illness. So we'll talk about that, but unfortunately that jumped to the top of the list last year. So getting a checkup, all about prevention. Next slide. Diabetes is a great example when we're talking about preventive healthcare. I love to use diabetes as an example because we want to prevent things on several levels. Next. First, we want to prevent the disease in the first place. So when you come in for your checkup, we're going to talk about exercise, nutrition, stress management, sleep habits, all these pillars of health that really prevent you from getting something like diabetes in the first place. Next. We also want to detect disease early before it becomes a problem. So I may be ordering some tests to see, is your blood sugar normal or is it starting to creep up a little bit? And we need to talk about ways that we can get it back down into a safe and healthy level before it actually starts causing problems. Next. And then if you are someone who does have a chronic disease like diabetes, we want to talk about preventing complications. We don't want you to be on dialysis. We don't want you to have something like an amputation or a heart attack. So we're talking about managing your condition very well to prevent future complications. Next. How is preventive health care done? It starts by you just scheduling your yearly checkup. We're going to talk a lot during your visits. There's a lot of education, a lot of troubleshooting, a lot of me getting to know you and your lifestyle and your habits, and working together to try and optimize habits that promote health. We'll certainly do an examination, listen to your heart and lungs, feel on your belly. I'll probably order some blood tests. We may order some pictures like x-rays, mammograms, and we may even talk about procedures like colonoscopies. And forgive the image here. So thinking about your next checkup, again, we want you to go into your visit either with an actual list, right? You can actually bring in a little report card for yourself, or at least a mental checklist of what you need to accomplish at that visit. And I kind of made a couple big categories. We're going to talk about heart health, cancer screening, sexual health, immunizations, and then kind of a grab bag at the end. Next. So for heart health, there are several things that you want to have done each year to make sure that you are heart healthy. And if you could just click forward, Tony, through the rest of the little, yep, you could just keep clicking through. For men and women over the age of 40 who are overweight or obese, that's a BMI of over 26. And that's, again, your height to weight ratio. You should be screened for diabetes. That's a blood test called an A1C. And that should be done at your checkup if you are at risk. For men over the age of 35, women over age 45, or my younger folks who have other risk factors, you should have your cholesterol checked. Cholesterol is a risk factor for things like heart attacks and strokes. So certainly if it was high, we'd want to talk about ways that we could lower it. Someone should be asking you whether or not you smoke. And if the answer to that is yes, talking to you about ways that you may be able to reduce or eliminate that big risk factor for heart disease and lung disease and cancer. So good to talk about that with your doctor at your checkup. Certainly, we're going to be screening for things like obesity and overweight by hopping on the scale, everyone's favorite item at the doctor's office. Certainly not mine, but we should check your weight and your height at your visit. And check your blood pressure to make sure that it's safe and healthy. And there's a special screening test for men who are age 65 to 75 who have ever smoked in their lives. You all need a one-time ultrasound of the blood vessel on your tummy. It's called your abdominal aorta. It's looking for aneurysms or ballooning of that blood vessel, which can be very dangerous. It's just a one-time test. But if you are a gentleman, 65 to 75, who has ever smoked cigarettes, make sure that that test is ordered for you. Cancer screening is a really big ticket item at your checkup. You want to make sure that you're up to date on your cancer screening. I kind of picked the top 5. So for women age 40 to 74, talking to your doctor about getting a mammogram for breast cancer screening. There are some other modalities or tests that are coming out, things like ultrasound and breast MRI. So stay tuned for that. But for most women, mammogram is an important test in detecting breast cancers early. Remember, with cancer, the earlier that we catch something like cancer, the easier it is to treat. When we catch cancer late in the game, it becomes very, very difficult and sometimes not possible to treat. So we want to catch things early. And you can do that just by staying proactive with your yearly checkups. For women starting at age 21, all the way through 65, we recommend cervical cancer screening. That's with a Pap test. And after the age of 30, we add screening for HPV or human papilloma virus. The tests are done every 3 to 5 years, depending on your age. However, even if you're in a year where you don't need your Pap test, please do remember to come get your well woman exam. There are other body parts down there other than just your cervix that we need to make sure is safe and healthy. Starting at age 45, this is a new change. It used to be age 50, but starting at age 45, now men and women should talk to their doctor about getting colon cancer screening. The gold standard, or really the best test for that, is a colonoscopy. Not everyone is super excited about having a camera in their bottom, and it may not be the right test for everyone. So there are other ways that we can accomplish colon cancer screening. Things like at-home stool testing can be done, which counts as colon cancer screening. So make sure you're talking to your doctor about some form of colorectal cancer screening. For gentlemen starting at age 45, prostate cancer screening is something that I would recommend you talk to your doctor about. This one is not such an easy, straightforward recommendation. There are some risks of prostate cancer screening that may lead to unnecessary testing. So it's not a definite, you need to go get your PSA starting at age 45, but it should be a conversation. For my family, I have an extremely strong family history of prostate cancer screening. So the gentleman in my family may definitely need to go ahead and do this, but it doesn't necessarily have to happen for everyone. Again, it's a little bit more of a complicated recommendation. So at least have a conversation about it so that you are able to make an educated decision about whether or not you want to get screening for that. Finally, lung cancer screening is done with a CAT scan. and forgive me, I didn't put the age here, starting around 55, I believe. If you have a 30-pack year history of smoking, you are at higher risk of lung cancer. How you calculate that is you multiply the number of packs you smoke per day times the number of years you have smoked. That number is over 30, and based on your age, you may need lung cancer screening. And again, that's a yearly CAT scan of your lungs. Next. Okay, moving on to immunizations. So definitely for children, we recommend all vaccinations according to the schedule, the CDC schedule, and that includes a yearly flu shot starting at age 6 months. And for adults, you know, we thought we got out of it after we got all our kids shots, but big people need shots too. Definitely a seasonal flu shot, which protects you against influenza. If you haven't gotten one this year, please think about going to get that. We're definitely starting to see influenza in the office. So it's a virus that causes life-threatening respiratory illness. And it's a yearly. So usually around October is a good time to think about going to get a flu shot. If you haven't had your COVID vaccine, this is of course a relatively newer one, although it's been out for more than a year now. Recommended for 5 and up. So if you haven't had a COVID shot, with the new variant coming around and the numbers going whoop in the wrong direction, please go out and get your COVID shot. Adults need a tetanus shot every 10 years. Pregnant women may be offered a tetanus booster during their pregnancy. That's actually to protect the baby from whooping cough. HPV is a vaccine that if you didn't get it as a child, you may want to talk to your doctor about getting that. It's for patients up to age 45 who may be at higher risk for contracting human papillomavirus. It's a good conversation to have at your yearly physical. 65 and older, we need a pneumonia shot. Pneumonia in older folks is very dangerous. It can cause a life-threatening illness. And certainly some patients with underlying medical conditions like diabetes and asthma, they may need to get a pneumonia shot earlier than age 65, but after age 65, everyone should get one. And a shingles vaccine after the age of 50. Next. Talking to your doctor about sexual health at your yearly physical, very important. For my females, someone should be asking you about your plans for pregnancy over the next year, whether that's yes, no, or I'm not sure. Just having an opportunity to talk about family planning is important. Making sure that you're up to date on STD screening. Certainly having, if you've never been screened for HIV or hepatitis C as an adult, you definitely want to have just a baseline and really risk-based conversation as well. So if you're sexually active without protection, definitely come in for screening. This is also an opportunity to talk about the HPV vaccine. Again, that one protects against cervical, head and neck cancers, as well as genital warts. So talking to your doctor about whether or not you should have that vaccine. And then there's kind of a couple other random recommendations that didn't fit nicely into a category. I'm going to ask you if you've had your eyes checked in the last year, whether or not you see a dentist. You should see a dentist every 6 months for your general cleanings. For my women, my older women, we need to get bone density scans. That's a test looking for osteoporosis. You may need that a little earlier if you have risk factors. As Conrad mentioned, someone should be asking you about things like depression, anxiety, and your mental health. Checking in with you to make sure that you're not needing any support in that area, and asking about alcohol use and drug use as well as a way to prevent complications and keep you safe and healthy. Next. So that's just kind of a brief surface level overview of the things that are kind of running through my mind when you're coming in for your yearly checkup. It really should be a dedicated visit for preventive health care. Many of my patients will come in for checkups and certainly have some health concerns, things like numbness, tingling, joint pain, chronic care management. We really want to give the time and the space, though, for just preventive care. As you can see, there's a lot of things that we may need to be talking about and going over and ordering for you to prevent disease and prevent premature death. So our goal is to kind of dedicate the visit for that. Certainly other health concerns, very important. We want the time and space to address those well. Oftentimes I may have my patients do follow-up visits so that we can dig deeper into those concerns and into those issues. But I want to thank you guys for coming in today for this Lunch and Learn. This is always a wonderful, wonderful opportunity to chit chat for me.